Well, school meals are getting a healthy makeover.
For the first time, the USDA will require schools to focus on products with less added sugars, especially in school breakfast. So I spoke with a pediatrician about the impacts this will have on America's school kids. School meals play a big role in the lives of America's school children. The USDA just updating the school meal standards. Joining me now is Dr. Mollie Grow, a pediatrician with Seattle Children's Hospital, as well as the University of Washington. Dr. Grow, tell me a little bit about these new standards. What do you think about them?
Well, I am really excited as a pediatrician that they're finally coming on board. They've been in the works for a few years now, and we're looking at improvements that are really important to children's health. This is the first time that we're going to have an added sugars standard, so the school meals will be decreasing the amount of sugars that are in, particularly in the breakfast. And then it's going to be phased in so that there are decreases in added sugars across the school week for all the school meals.
What else do we find in these new standards? I know last time we spoke, sugar was a concern, so was sodium. There was a few other things. What else are in the updated standards?
Well, these standards are really incremental, and I think they have primarily focused on the added sugars and then added in some decreases in sodium. They softened those a little bit from the initial proposal based on input from the many stakeholders involved in this process. So I think we're seeing some standards that are really reasonable updates around the sodium, and then also trying to keep up with the really good changes that had happened already more than a decade ago around having whole grains and making sure that we have more of the non-processed foods and some locally sourced foods that are part of the school meal programs.
Is it enough? Would you like to see more?
Sure. As a pediatrician, I'd always love to see us continue to make, as strong as possible updates, but I think these are really important and next steps and just increments that we need to keep making, and to really be focused on the added sugars for the first time ever. These are guidelines that are in place for school meals, and that is a fantastic step to make. Sure, I'd love to see a few more things in there, and in particular, really trying to get to less of those processed foods for kids in the school breakfast and lunch programs. And I will definitely accept that these are benefits that they are going to see across the board for the millions of children that are fed through the school meal programs. There are 1 million in Washington that will be touched by these updates, and 30 million across the country who will be benefiting from these improvements. So we'll take it.
What kind of health concerns are you seeing in your patients that make these changes so important?
So it's a great question. So we are seeing much higher rates of diabetes, of high blood pressure, and early heart disease happening in children and teens. And we know that these things are directly related to dietary factors and to kind of lifestyle factors like physical activity. So being able to make adjustments in how we eat is one of the most important things that we can do to take care of ourselves and prevent those really hard diagnoses like diabetes and high blood pressure and heart disease. So I'm excited that we're taking steps towards aligning the school meal standards with the national dietary guidelines for Americans, and making sure that kids get the benefit of the things that we know from science are good for our health.
This is a gradual, phased-in approach. Talk a little bit about the timeline with when we do start seeing these changes go into effect.
Right, so they'll first be implementing some of this graduated changes next year in 2025, and in particular tackling the added sugars in the school breakfast. So cereals and yogurts have been a source of added sugars, and much higher than they need to be. So it sounds like some of the source of those foods have been, the manufacturers have already gotten on board with plans for adjustments that will be in place by 2025. And then they'll phase in over the next couple of years after that, with completing all of the guidelines by 2027. So it's gradual, and it means that there's nothing so dramatic, but we're going to see important benefits, I think, with those changes.
In the meantime, while we wait for this approach to be, phased in over the next couple years or so, what can we as parents do, we as caregivers of children do to make sure they're eating, a healthy, balanced, nutritious diet?
It's a great question, and there are a lot of great things we can do. So one is shopping the perimeter of the grocery store where all those fresh foods are offered and sold. Reading food labels, there's now a section where all foods have that added sugars label that are packaged foods, and so you can look for 0 added sugars or very few added sugars. We're looking for less than 10% of the calories of the week being from added sugars, which is one of the new standards that they're including in the guidelines that will be phased in. And we, want to keep up with basically eating as many foods that we can make at home ourselves with home prepared foods. It's a great way to bring families together, have a meal together. It can be fairly simple, but adding those fruits and veggies in all of our meals and really looking for the whole foods as much as we can are great ways to keep ourselves healthy.
Overall, we want healthier food so we can have healthier kids.
Absolutely.
Okay, Dr. Mollie Grow, thank you so much for joining us.
Thanks for having me, Holly.
Back to you. And again, as we mentioned, this is a very gradual, phased-in approach. Not